Hello and welcome to my channel and to part 2 of my journey with chronic illness. If you've been enjoying this content, please don't forget to hit the like button and subscribe for further updates. In today's video, I'll be talking about commencing rehabilitation and a medical crisis that ended with me in hospital getting emergency surgery. In 2015, my insurer wanted me to do something called graded exercise training. So that involved going to an exercise physiologist, and he created a program for me. Now, he had chronic fatigue himself at some point, so he understood how I was feeling. He gave me a gentle graded program, which I worked on, and that was basically doing some walking around my neighborhood and some very light weight-bearing exercises at home. But eventually we worked towards me going to the gym. And I was going to the gym for a few months. And then in the middle of 2015, I started to feel chills all the time, which is something that I had at the very beginning. And I also had a tight chest and I was coughing. I was still persisting because when you have chronic fatigue, you don't wait until you feel good to do anything because you just feel awful all the time anyway. And one day I was on the elliptic machine and I got this cough and I just couldn't stop coughing. I couldn't catch my breath. So I went to my GP, but she was actually away at the time. So I had to go and see the practice manager of the clinic. And this woman, she took a look at me and she said, "You have a chest infection," and she gave me antibiotics. And I said to her, "Look, do you want to listen to my chest?" And all that. She says, "I don't need to do that. I'm just going to give you these antibiotics and you'll be fine." So I was a little bit surprised, but I took the antibiotics and I didn't get better. And then a few weeks later, I felt a lot worse. One night I was actually in bed trying to sleep and I couldn't catch my breath. I had terrible pain in my chest and I was coughing and I got really scared. A doctor came out that night to the house and he listened to my chest and he said, "Look, there's an issue with your lungs." And he said to me, "You can either go to emergency tonight or you can go and see your doctor tomorrow." So I elected to go and see my doctor. Once again, my GP was still away. So I went and saw another doctor at the practice, not the lady I'd seen before. And he ordered an x-ray. And when the x-ray came back, it turned out that I had fluid in my left lung. And he said to me straight away, "I'll need some surgery." So while I was at the doctor's office, he called a surgeon that he knew, and the surgeon said, "Hold up, I think we should get a CT scan." While I was at the scanning place, the people who were doing the scan came back with the results, and they said, "I'm sorry, but you have fluid right throughout your abdomen. It looks like it's around your heart as well. We're going to have to call an ambulance for you right now, and you're going to have to go straight to the hospital." And for me, I was very disoriented. I was very upset. I got taken to hospital and consulted with the surgeon, and he actually ordered an ultrasound for me. The ultrasound was of my heart, and when the results came back for that, he told me that my heart was actually swinging around. I had a pericardial effusion. The fluid was compressing my heart and causing it to move around, and then I would have to have emergency surgery that night to drain it all out. So it was really a surreal experience for me. My body was struggling so much to pump blood because of this compression that was happening with the fluid. I was surrounded by my family at the hospital and I had to say goodbye to them, and I didn't know if I was ever going to see them again at that point. They prayed with me and they hugged me, and I went off and I had to wait for the surgery. Now, there was a little bit of a funny moment while I was waiting because the surgeon came in with the anesthetist and they were talking about where the incision would go. And I remember saying to him, "Can you please hide the incision?" Because I'd actually had my gallbladder removed when I was around 19 or 20 years old. And I had this big scar just above my belly button. And so I said to the surgeon, "Can you please, make sure the scar is hidden?" And he looked at me and he said, "We're trying to save your life here. We don't worry about the scars at this point." And I said, "Okay." And then away they went. And I was just waiting in that room. It was like a pre-op area. Something about being in that situation where you're considering whether you're going to be alive at the end of the surgery. I started to go back in my mind through my life. It's just something that just happened. I wasn't trying to do it. I felt this immense peace just come over me. I didn't feel afraid, and I just felt all this gratitude for what my life had been and all the experience that I'd had and the people that I'd met. And then they took me into surgery. And I'm sorry about some of these medical details, but I'd never had emergency surgery before. And it's very different to a planned operation that is very controlled and they put you under before you see anything. When it's emergency surgery, it's not like that at all. So I think it was something to monitor my blood pressure that the anesthetist had to insert. And so they had my wrist and they were cutting my wrist. And I don't remember any anesthetic. They were just cutting me. And I turned to one of the nurses and I noticed that the nurse had all these tattoos on his arm. I asked him about the tattoos and for some reason, I just knew to focus on these tattoos. And he was telling me the story about each one. And that's how I got through that moment. Eventually, I was put under, and the next thing I knew, I was waking up in intensive care. All I could see was bright light, and I thought, am I in heaven? And then this nurse was looking over at me. She was speaking to me, and I was trying to talk back, but I couldn't because I was on a ventilator. So once she got the ventilator up, I remember saying to her, "You're an angel." I found out later from my family that I'd been on a ventilator for about 12 hours. And they do that so that they can deal with the pain. They drained 3.5 liters of fluid out of my body during the operation. And they'd made an incision under my left breast. And there were 3 incision points that were below there that had tubes attached to them. And I had a drainage pump to drain the wound. Now, I stayed in the hospital for, I think it was a couple of weeks, and I was really weak. I was in a cardiac ward surrounded by people who were many, many years older than me. And I spent time walking around that ward and trying to get my strength back. And then I was moved to a rehabilitation hospital for about a week and then home. And I looked really, really unwell. I had big circles under my eyes. I'd lost a lot of weight and I was really weak and I was on quite strong painkillers for quite a few months. And I look back on it now and I just really think that the exercise program that I was on, obviously that didn't make me sick, but I think that made me run down. It was pushing my body too hard. And these days, I don't know that graded exercise therapy is as recommended, and there are studies that show that it isn't effective for all people with chronic fatigue syndrome. So I learned that lesson to listen to my body, and if I don't feel up to exercising, to rest. During 2015, the insurer provided a rehabilitation consultant for me, and I'd seen them and we were trying to work out what I do next with my career because my doctors all said to me, I can't do what I was doing before. I won't be able to do that kind of office work. I won't be able to do work that's that intensive. And the rehab consultant guided me through a process. It was really quite amazing. And that was helping me to work out how I could use the skills and interests that I had to move into a new career. And I had been a musician since I was a little girl. We worked on considering whether I might move into music therapy. Now, when I looked into music therapy, I realized what a long road it would be to get there. So I had to do a bit of psychology training, and then I had to do an audition, a musical audition, and apply for the course. So it seemed like an impossible mountain to climb. But my consultant said to me, well, let's just take this one step at a time. So I was already on the path. I had started to do some volunteering. I was going to a day center for people with disabilities, and I was doing some singing and piano playing with them. One funny thing about being in the hospital is I got my sister to bring my laptop in, and I decided to apply for this psychology course. I was so determined that I was going to get well, and I was going to do the psychology course. In my mind, I was going to come through this surgery, I was going to recover, and then get on with my normal life. I was going to reskill and get back to work and be able to work full time. I was still on medication for around 6 months after the surgery and weaning myself off that. And when I started the psychology course, I would go for 2 hours a week, and I couldn't get myself there. I couldn't drive that far. It was around a 45-minute drive. So I would either take the train and hobble into the university, or my parents would take me. And often they would pick me up at night because it was a night class. And I remember sitting in the class, and I had that thing again with my legs just aching. After the first hour, I could barely stand it, and I could barely listen to what they were saying. But I did my best. I went in as many times as I could, and when I couldn't make it in, I would listen to the recordings. And got really good marks, and I was really pleased with that. The second part of 2016 was actually preparing for the audition. So I went back to my piano teacher, and we worked together on creating 3 audition pieces. And I also had to learn the guitar. Now I'd learned a few chords here or there, but piano was my main instrument. So I bought a guitar and I taught myself, and I did the audition, and I got in. And when I started the course, I was still quite unwell. I had to get special consideration for many assignments. I needed extra time. And I did the course. It was a 2-year full-time master's course, but I did it over 4 years. And it was really hard. And during that time, I had many flare-ups. My health was just up and down. It was a roller coaster ride for me. I would have a few weeks of feeling okay and managing, and then I would have times where I would just be bedridden. And so once the semester started at uni, those 12 weeks, by the end of those 12 weeks, I was really, really struggling. I could barely cope. And that would only be going in a couple of days a week. My chronic fatigue specialist sent me for a beach holiday to try and recover because he thought that seawater and sunlight would really help me. But I was also on a bunch of other protocols to get well. So that was 2017 to 2020. And by 2020, of course, that was when COVID came. I had to do my final year online, which suited me really well. And actually, when we went into lockdown and everybody was locked in, suddenly I could attend social activities because I'd lost so much. One of the things about having chronic fatigue syndrome is it devastates your life. And I know there are worse illnesses out there, and I'm not trying to say that what I suffered was more than other people have suffered with their illnesses. But I don't think people quite understand how debilitating chronic fatigue is. And it is a systemic problem in your body. And it affects every aspect of your life. It affects you financially. It affects your relationships. It affects your social life. It affects your identity. It affects your ability to eat and digest food. And that affects your social life as well. It affects your ability to engage with the world on lots of levels, to take in information, to remember things, to understand things. I used to read books and I would immediately forget what I read. So one of the great things about doing the piano lessons back in 2014, 2015 was that it was great cognitive training for me. It really helped me to be able to focus my attention. That brings us to the end of part 2. In part 3, I'll be talking about the impact that illness has had on my life and the steps I took to get back to work. So thank you very much for listening, and I'll see you soon.